Hello everyone, good afternoon. Thank you so much for joining our webinar. We will be talking about chronic care management and transforming the way chronic conditions are managed. We have begun a recording of this session so that you can revisit it later. Also, if you have questions throughout the presentation, please feel free to ask them and put them in the question box, and we will address all of those at the end. All right, and we are going to go ahead and get started here. So our agenda for today, we will have some brief introductions of our speakers. We will discuss Microsoft in Health and the involvement that they have, the patient journey and how the patient walks through their experience in a healthcare system. We'll have an overview of chronic care management, and then we'll move into a specific use case of WARFARIN. At the very end, as I mentioned, we will have a question and answer portion. So our first speaker for today is Ms. Tracy Picon. She is a director in the healthcare department at Microsoft. She is responsible for driving business development of strategy and solutions and partnerships with healthcare partners and healthcare providers. She's had over a decade of experience in the healthcare industry with extensive experience working for a large medical device manufacturer. Our second speaker for today is Ms. Patricia Becker. She is the Chief Strategy Officer at Mazik Global. She has 25 years of executive healthcare information technology experience working with the University of Chicago Medical Center and University Health System Consortium. Pat Becker is also an adjunct faculty member at Northwestern University and a HIMSS Fellow. We thank our speakers, Pat and Tracy, for joining us. And I'm going to turn it over to Tracy to kick off our presentation.
Thanks, Taylor. Hi, everyone. Thanks for joining today. So as we go through this presentation today, we all know that healthcare is going through a digital transformation, whether that was moving from paper records to electronic medical records, and then the future and what technology is going to support where we need to take our healthcare industry, whether it's our patients, the providers, or the organizations themselves. And the growth in technology, we've seen growth in technology across all consumer industries, and it's just hitting healthcare in a new way. So that growth in technology that we've seen across all segments of the population is really increasing the availability of medical information that drives organizations to improve the customer service, to really drive the customer service that they offer to the patient, right? So they're really impacting the patient experience. Gartner says that quality of patient experience depends on the organizational culture that fosters it and the IT that enables it. So leading health organizations are really on the cusp of finding innovative uses for technology that enhance patient cares in ways that we've never really seen before. And what we need is technology that combines actionable, accessible business insights that's flexible and adjusts to the business processes, that really will allow and empower organizations to be data-driven and competitive in their market. And we haven't really had that before. Let me back up for a second. We have had that before, but none of it's been automated. None of it has been empowered. It's been done at a very manual level. And I think, excuse me, we've reached a precipice in healthcare where we have to understand where technology can support our business, support our care providers, and support our patients and their communities along their journey, whether it's through chronic disease management or through a new ailment that they have. But how does technology really impact streamline care coordination, connect all the systems together so that we can really expand the continuum of care, and then proactively reach out and engage our communities so that we the end result is better patient health, better patient experience, better provider working experience that we have. There's I have a small example where digital and mobile technologies, how they can help bridge the long-standing divide between the patient and the care provider, between the participation of that patient and the care provider. There's a large hospital system that had already developed a patient portal, which many of our organizations that we work with have developed patient portals to really help patients access and share their medical information. But this particular hospital developed a patient portal that helped the patients access their own medical information while visiting the hospital. But they needed to further improve that inpatient experience. So they decided to bring all of that information to the bedside with mobile apps, or mobile tablets, excuse me. And through the tablets, the hospital was able to increase the patient engagement in their own care during the stay. So not only did the tablet let the patient know who their care team was, but it also let them call a nurse or send a message via a tap of a tile on their device. And future plans at that hospital include communicating with family members over the internet outside of the hospital, outside of the four walls of the hospital. And I think it's important for us to realize that so much of the care that we're going to be giving to our communities is going to be outside of the four walls of the hospital as we move from a fee-for-service to a value-based model. And regardless of the political arena that we're in right now, we know that there are going to be several items that maintain their focus. It's going to be on security of health information, on patient experience, empowering your care teams, engaging your patients, and optimizing clinical efficiencies, which you can see there on the screen. So when we take a step back, what are we really talking about? What we're talking about is how do you engage your patients? How do you create a patient-centric experience? Is it giving the patients access to self-service, giving patients access to their health data and personalized plans? Is it empowering your care teams to spend more time with the patients via the use of technology and connected patient devices that reduces input time, reduces tracking, or reduces management of all of that patient data so that they're really dealing with the patient and not with the computer at that system of record, right? So how do they engage? Is it proactively engaging the patients in their health? How do you do that? Is it by increasing health resource usage, creating online tools, creating self-assessments? How do you prevent readmissions how do you prevent readmissions in your organization? Is it through reaching out to your patients with preventative care or health updates, or reaching the patient at the patient's convenience to improve the management of their chronic disease? Ultimately, how do you empower your care teams with effective, efficient care coordination? And we talk about all of these things, like how to engage our patients, how to empower care teams, but what does that really mean? So, how do you optimize your clinical and operational efficiencies? We all have ideas of how that's done, but how do you manage expanding caseloads and increase efficiencies? How do you, using familiar tools, how do you allow providers and workers to streamline their clinical processes or automate workflows that have historically been very manual? How do you empower or improve your care team collaboration and communication? And all of these how-tos can happen through technology, that can be supported through technology. And then in the end, all that technology has to be secure. It has to be compliant. It has to have the strength, trust in technology security, whether it's making sure that your data and systems are secure by using tools that are protected by powerful cybersecurity and threat defense systems. Is it demonstrating compliance more easily by streamlining access to your regulated information? And ultimately, how do you maintain privacy and control while you're using this new technology to empower your care teams, to engage your patient, to increase your operational efficiencies, and ultimately then transforming that care continuum. Taylor, will you skip to the next slide? Thank you. So this is one of my favorite slides. This is really talking about empowering health through the patient journey. And when I look at this, you do see the patient's journey throughout here. You see them, coming into the emergency room, through the working through the entire organization. But what we don't see here is all of what the organization is doing behind the scenes to enable this patient journey, right? The security and compliance of all that information that the patient, as they move through here, there's the security and compliance journey that they're going on, the IT's journey that follows through this patient. There's the operations journey that follows the patient as they move through the organization, and really outside of the organization. It might not, the care team journey that follows the patient, the marketing journey, all of the lines of business, all of the service lines, all of the departments within a hospital organization follow along the same journey that the patient takes. So how do we empower, through the use of technology, both the patient, the organization, and the care team through this journey as the patient moves throughout, and through the provider as they go through the same journey with the patient? So I'm going to turn it over to Pat, unless there are any questions right now, but I'm going to turn it over to Pat. She's going to walk through a case study and some additional information, and then we'll come back together at the end of that.
Thank you, Tracy. Good afternoon, everyone. This is Pat Becker. Let's start first by thinking about what care management is. CMS has defined care management as a patient, or chronic care actually, as a patient that has 2 or more chronic conditions. And so they need a coordinated care plan with fluid communication between and among providers and the patient. They particularly need medication management. Since there are usually at least 2 chronic conditions, it's important that the medication be managed among those conditions so that the medications do not interact in a negative way on the patient. They need a comprehensive care plan that is established, but it can't just be established, it must be implemented, which is really the implementation of a workflow related to that patient. The care plan must be revised, and most importantly, it must be communicated and shared with all providers, the patient, and the patient's care team and support network. The goal is to engage the patient in their care and to provide better health outcomes. And why is this so important? If you look at this slide, it's just phenomenal the amount of money that's being spent on chronic care today. It's estimated that 86% of the healthcare spending within the U.S. is on chronic condition management. It's also estimated that this cost could raise to $4.2 trillion by 2023. That's just an astounding number. Today, or by 2020, it's estimated that there'll be 150 million patients within the U.S., or 40% of the population will need to have a chronic condition managed. So we're going to tell a story about one patient with a chronic condition. And this story was originally publicized in the Washington Post, and it highlights some of the issues with chronic care management today. An 85-year-old man was taken to the hospital with bruises all over his body. Because he had an abnormal heart rhythm, which can lead to stroke, he had been prescribed Coumadin or warfarin. Coumadin is a generic brand of warfarin. It's a common drug. In fact, it's the second most prescribed medication after insulin, but it must be monitored carefully. He was in a nursing home, and the nursing home staff did not appropriately perform the required monitoring, which led to bruising, which is a sign of internal bleeding. By the time he was taken to the hospital, it was too late, and he passed away. This could have been prevented by having regular blood tests that monitored the levels of blood clotting and would have shown the doses was not appropriate for him. As you can see from this map, warfarin or Coumadin is a highly prescribed medication in nursing homes. Some consider Coumadin the most dangerous drug in America. A 2007 study in the American Journal of Medicine, estimated that nursing home residents suffered 34,000 fatal, life-threatening, or serious events related to this medication. The drug interacts badly with certain foods and medications, particularly antibiotics, and it requires regular blood tests to ensure it is working as intended. The tests measure the time it takes for blood plasma to clot. So a care plan needs to be developed that monitors the medication regularly with blood tests and alerts the providers when changes occur that could impact on the medication, such changes as new prescriptions, particularly for antibiotics, a change in the patient's weight, and other factors. So warfarin is also known as Coumadin or Janaven, and it's, as I said, it's the second most widely prescribed drug after insulin. It's estimated that in 2007, approximately 20 million people had been prescribed warfarin. It must be taken as directed, and also it must be monitored at least monthly after the initial period of adjustment. But many factors can influence the effectiveness, such as a change in diet, weight gain, other medications, particularly antibiotics, and it's the second most common drug indicated in emergency room visits for adverse events. So we are working with an organization in the Northwest to help them with their warfarin management program. While it is their protocol that all patients who are prescribed warfarin are managed by their warfarin clinic, they have found that occasionally patients will be falling through the cracks. So they've asked us to come in and help them with alleviating the situation. So we've developed a solution for them. And the solution is that we are data mining their data warehouse. Their data warehouse has been in existence for a number of years, and it captures all patient-related activities. The data warehouse is updated every 5 minutes from their electronic health record. And as I said, we're mining it, looking for any new prescriptions of warfarin or its genetic equivalents. Using machine learning, we'll also be able to broaden their knowledge about warfarin and its side effects. When a new patient is identified, a task is created in a queue for the staff of the warfarin clinic. A communication is also sent to the prescribing physician, alerting him that the patient is being contacted by the warfarin clinic. A rules-based workflow is engaged and a series of other tasks are created. The first task is to call the patient within 72 hours. And the reason for that is that warfarin takes 3 days to have its initial impact on the patient. So by contacting the patient within 72 hours, what they're trying to do is to set up a series of 4 visits for the patient within the first 2 weeks of the patient beginning their treatment. This is the second task that's part of that workflow that I talked about earlier. When the patient arrives for their first visit, another series of tasks in the workflow are engaged. They receive a blood test, and once the results are available, they meet with a pharmacist and perhaps a physician if that's needed. This first visit is vital. The patients and others who come with them for that first visit go through a thorough overview of the medication and the precautions needed while taking it. They are set up in a patient portal where they may contact their care providers with updates on any changes in their condition. Communication among the provider and between providers and patients is key to keep up to date with any changes that could impact the dosing amount. The patient portal also will contain additional patient education materials for the patient, and that can be shared with his family and any outside care providers that the patient may see. Once the patient is stabilized on a warfarin level, usually after the first 4 visits, they are monitored in the clinic on a monthly basis. This monitoring is critical, and they go into a different branch of the patient workflow. Once they they come into the clinic for blood work, and if the blood work is normal or within the limits that is needed, they do not need to see a clinician or a pharmacist unless they choose to, and they are released to go home. Usually this process can take less than a half hour, and it's very good for the patient to know that their blood work is normal and they're released to go home. If there is any change, however, they are immediately seen by a pharmacist. The reason for the change are discussed. Perhaps they've had a change in their diet, or they've gained weight, or maybe they're taking some other medications. Their medication level is adjusted immediately, and follow-up will be scheduled. Sometimes that may be less than the normal monthly period because they want to continue monitoring. It all depends on exactly what that blood work shows and the reasons for the changes. If at any time the patient does not show up for routine monitoring, tasks are created for the staff to follow up and the patient is contacted. These tasks may be escalated to an administrator within the clinic if they are not able to resolve why the patient has not come in within the specified time frame. So there's continuously monitoring of both the patients that keep up with their scheduled appointments and those that don't, so that no one falls through the cracks. At any time, the patient or their designated family or friends may also use the patient portal to initiate questions and to report any issue. The portal will be continuously monitored for these questions, and staff will and tasks will be created for the staff to follow up. And again, that escalation will be available. A comprehensive workflow with tasks and escalations will allow for the continuously monitoring these patients, decreasing the possibility for adverse events. So as we continue to work with clinicians in this clinic, we will be using machine learning against the data warehouse to help monitor the patients. Some examples of what we will be looking for is changes in the patient's weight. Perhaps the patients come into a different part of the organization, and we realize that his weight has increased or decreased sufficiently that we want to follow up in the warfarin clinic. We will be looking for other medications that were prescribed, particularly for antibiotics. But over time, we may also find correlations that could lead to other needs for a change in the dosage of the medication. Obviously, this is just one chronic disease that we are looking at, but we're finding ways to assist clinicians in providing better quality care and reducing overall costs by catching any potential adverse events before they happen, saving visits to the ER and suffering by the patients. This is a model that can be applied to other categories of chronic care. So some takeaways from this. As we have shown, the management of chronic care conditions is a major problem facing the U.S. healthcare environment. Chronic conditions now account for 86% of healthcare costs and impact 40% of patients. We have shared a story of one patient's negative experience and the potential negative impact that just one medication can have on the population. We have shown that the issue of trying to manage medications medication in one healthcare organization. We have shared how we are working with that organization to mitigate the potential negative impact by putting in place a software solution that will first identify all patients needing monitoring and then having a mechanism and a rule-based workflow in place to monitor the patient throughout their use of the medication, allowing for a quick reaction to any changes in the patient's condition so as to mitigate any adverse events. And now I'd like to turn it back over to Tracy.
Thanks, Pat. So we're going to go this slide, the empowering health through the patient journey slide. We talked about this before, but the difference in this slide and the other one is this one's really shows you where throughout the patient and provider and organization's journey, here you can see where you have technology that impacts each position of that journey. And this is a very high overview, very high level overview of what that patient journey is, but you can see where Microsoft has products and solutions that many organizations are already using today. It could be Office 365. Maybe there's a portion of their IT suite that's using Azure, or maybe it's on-prem. There can be the Dynamics AX or ERP, the financials and operations solutions, Dynamics CRM. There can be the security essentials. So throughout this patient journey, you can see where the impact of utilizing technology that you already have, the integrations into those technologies that you're already using, the transparency layers that are provided from using technology platforms that you're familiar with, right? Eliminating some of the change fatigue of employing a new system or solution. All of that is taken down many notches by using systems and solutions that our organizations, our customers are already familiar with. So it could be the Office suite, it could be CRM maybe in the marketing department, but how does CRM affect care coordination and chronic disease management? How does it affect the providers working outside of the four walls of the hospital to really help patients and providers manage chronic disease or manage the illnesses? So there's just multiple technologies, multiple solutions that Microsoft has developed to empower healthcare. Multiple products and solutions where we work with our partners like MazikCare to develop additional IP for those solutions that's specific to healthcare, and then look to see where does it impact this journey that the patient goes on, the provider's on, and the organization itself is on. So again, super high level, but it really goes to show the integration layer, transparency layers, affecting change fatigue with new technologies. We're not in a place today where having or purchasing a single technology is going to solve these bigger issues that we're now dealing with in care. When you move from a fee-for-service, an encounter-based system to value-based care, you have to change the technologies. We need to integrate better. We need to create better solutions. And so this is showing you where solutions that you're already working with are can be expanded to help you manage your overall organization's vision for their healthcare environment. So that's really it. I think we can open up to questions now.
Thank you so much, Tracy and Pat. That was excellent. We have been monitoring the question window throughout the presentation, and there have been a few questions. So let's go ahead and get into those. All right. So the first question that I see, Pat, this is probably a good question for you to answer. How would this type of solution monitor patients outside of the clinic settings, outside of the four walls of the hospital?
So one of the ways would be to have the patient put in any changes that are occurring in his healthcare into the patient portal to ask questions of his provider. One of the advantages this particular organization has is that most of the patients within that that come into that organization receive 90% of their medical care within that organization. But there can be other ways that a patient gets care. So maybe they go to an urgent care clinic because they have a cold and they're subscribed an antibiotic. And so one of the things that it's important for the patient to do is to make sure that the clinic knows of any changes that occur with their health care. And that's why the patient portal was so key, is to keep the clinic up to date on those changes so that they can immediately react to any changes. And that's why education is so important. And we talked about at the first visit, the education the patient receives and their significant others or other people within their ecosystem that help take care of them, so that those people know that if there are any changes, that it's important that the warfarin clinic be notified of those quickly so they can react to them.
Excellent. That really speaks to, following that entire patient journey, as Tracy had talked about before, not just within the hospital, but extending that among multiple people and multiple facilities as well. The next question that I see is, can you talk a little bit about machine learning and how it applies to this case? You had mentioned it before when talking about the customer scenario.
Sure. As I said, we're going to use machine learning initially to help just identify, to make sure that all the patients within this organization that have been prescribed warfarin or one of its equivalents is first referred to the warfarin clinic. And then we're going to continue to use machine learning so that as that
Okay, great. So that was an overview of the machine learning. I think that was a good overview in terms of um, how it can impact, all those different areas and have a good effect there.
Taylor, this is Tracy. Pat went on mute, so we didn't actually hear her answer to the question.
Oh no. Let's repeat that question because I think the answer was very good. So I will thank you, Tracy. I'll go ahead and repeat the question and then I'll have Pat answer. So the question again was, how does machine learning, how is that used in the scenario, and how does that benefit the chronic care management?
I think we might be having some technical difficulties.
Okay, I'm just going to use Taylor's headphones here.
Oh, perfect. Okay, we can hear you.
Okay, so machine learning plays a significant role in what we're rolling out at this particular organization. First, we're going to use it to help identify any patients that have not been referred to the warfarin clinic. And we're going to do that by rolling through their database and looking for anyone that's been prescribed warfarin or one of its equivalents, and then create that workflow that I discussed earlier. Second, we're going to continue to mine the database once the patient is in the clinic. And it's important to understand that within this organization, it's a fairly closed medical community. So most of the patients receive upwards of 95% of their care within the organization, either in the outpatient areas or in their particular hospital. But we're also going to mine the database looking for any adverse potential impacts, whether it's a change in weight, change in noted diet, or any prescriptions that the patient has. Secondly, and then finally, over time, we're going to look to see if there are other correlations in either lab tests or medications that we see as having a potential impact on the results of the warfarin dosage. And that's going to be a longer term project, but we're thinking that potentially could be very impactful on these particular patients. So Taylor, are there other questions?
It looks like there's one question on the technology side. I think Tracy, you would be great to answer this. One. Tracy, could you discuss a little bit about Microsoft's commitment to security and privacy as it relates to patients as well as in the different cloud and Azure offerings?
Yeah, okay. So first, I would say that Microsoft's commitment to security is huge. Being that we are HIPAA compliant, all of our solutions are HIPAA compliant, and then we also have on the government side several levels of security, which are much more intense than the HIPAA security that's needed. So when Microsoft looks at security, we're really looking at that end-to-end trust approach to security and privacy as a part of a comprehensive vision for a trustworthy internet ecosystem, one that would enable everyone to make effective trust decisions about their health information, which would include devices, operating systems, applications, the application platforms, trusted people, so identity-based access combined with encryption and certifications and authentication that would enhance control of access to confidential data and information, documents, and care records. There's also the trusted data side with information rights management, restrict documentation, permissions for specific people, so security levels within the organizations at each level, right? So whether it's the call center or marketing or a case manager or provider or the patient, there's those customized security levels at every point of access of that information. And then also audits, right? Built-in security technologies throughout the entire IT environment that would help create a consistent reinforcement of regulatory compliance. So ultimately, Microsoft delivers an end-to-end trust across on-premises, cloud, and hybrid to device scenarios. So we talk about the cloud a lot, and we do see that as the future of many organizations, many industries, specifically the healthcare industry. But we do have we have that on-premises, cloud, and then the hybrid scenarios. Addressing healthcare regulations really is embedded into the Microsoft's cloud solutions. With Microsoft's cloud solutions, the healthcare organizations can consolidate onto one cloud with one infrastructure partner with a common security and privacy framework specifically tailored to help address the compliance needs of healthcare covered entities. So ultimately, what I think we're saying is all of the power and flexibility of the data platform has to be backed by capabilities that keep data accessible and secure. And I think that's really the power of the Microsoft data platform, is that we can take a hybrid approach that gives the customer the ability to get the most out of their on-premises investments while they move certain workloads or while they continue to move larger workflows to the cloud.
Excellent. Thank you so much, Tracy. That was a fantastic answer. It looks like we have one last question, and this is around the flexibility of a system like this. So in the scenario where a doctor or other clinician may need to add some different functions or categories of diseases in the future, how does this apply to other areas besides just the warfarin scenario that we spoke about today?
So warfarin is just one clinical pathway that is possible within this workflow. If you really think of workflows, clinical pathways, they're really workflows that need to be constantly adapted, not only within the particular disease that is being taken care of, but also for the particular patient. As we said earlier, chronic care, usually those patients have at least two diseases that they're trying to manage. And that being the case, the pathways need to be able to be adjusted for that particular patient, for the medication that patient's taken, and for adapted to any changes that occur. And that's the nice thing about the particular solution, is that it is very adaptable to the patient. Obviously, you want to use the best treatment plan that has been researched for the particular disease, but it is the case that these need to be adapted to the patient and other conditions that the patient has. And so they're very, very flexible, and I guess that's a long-winded way of saying they're flexible, but that's an important function with this solution that we've created.
Excellent. Thank you again, Pat. It looks like that is all of the questions that we have for today. I would like we would all like to thank all of the attendees for joining us today. If you have any questions, please don't hesitate to reach out. It was a pleasure speaking to you about chronic care management and the technologies that enable them. So thank you again, everyone, for your time, and we look forward to speaking with you in the future.